How is it that the wealthiest country in the world has such a screwed up healthcare system? After 35 years in the healthcare industry, I decided to retire and share my secrets with you. I'm Chuck Melendi, and this is Disruptive Dialogue. Hey everybody, Chuck Melendi here with Disruptive Dialogue. I'm excited today. I have a dear friend who not only did I go to college with him, it was in his fraternity. We actually were roommates. Scott Robey. He is a partner at an accounting firm, Warren Averett. He's been there over 30 years. His experience goes across all aspects of public accounting, whether it be tax work, auditing, financial planning, you name it, Scott's done it all. He also works across industries. And so I asked Scotty to come here today because one of the things you've heard me talk about is that when we talk about the high cost of healthcare, we are always concerned with, well, you know what, if I'm sick and I have to go to a hospital, then it's a big deal. Or if someone in my family gets hurt, then it's a big deal. But at the end of the day, it's not just an issue with if you're going to get care or not get care, or care is too expensive or it's not. It impacts every business in this country. It impacts inflation. It impacts our competitiveness in the world. And so who better to bring in than, I can say this because I'm a past one, a bean counter, yep. But a really good one, yep. To talk about the impact on employers and how that's going. However, before we go there, Scotty, as you know, I'm semi-retired. I left the corporate world, so I'm supposed to still have fun. Yep. So I busted out the brown today, and we're drinking Woodford Reserve with a big rock.
Yep. And hopefully I'll join you soon in retirement.
That'd be nice.
Yep.
Cheers. Although I'm working harder now than I used to work at J&J. Okay, so Scotty, I gave him a quick rundown of you and kind of what we're going to talk about. Mm-hmm. Anything as far as your experience or who you're working with that you'd like to expand on, or do you just want to jump right in?
We'd probably just jump right in. I mean, the biggest thing is I deal with a lot of families that they're more closely held businesses.
Okay.
Our firm, we don't do a lot of public companies, so it's not a lot of public stuff. It's more local stuff. I mean, there are large entities and large companies as well, but it's, you're dealing with insurance of, where they have employees of over 1,000 to the small businesses where they have 10 or 20 employees. So,
and that's the majority of businesses across the country. So, I think that's the majority of people who will be listening.
Right.
So, and what impacts, look, if you're in a corporation, a small business, 5, 10, 20 people, that's one thing. But start to get 50 or higher, that's a big deal. I mean, it's a big deal no matter where you are, but the costs are getting substantial. Yeah. But I do think at the end of the day, this applies to everybody. So I've got some questions here. One of the things when you're talking to your clients, does the cost of healthcare to their business, does it impact their long-term planning, their strategic planning? I mean, is that a factor in what they're doing?
When we're looking at planning in either tax planning, long-term projections, things like that, you're looking at every item on the income statement.
Yeah.
But the bigger ones are going to be your salaries, and related to your salaries is the healthcare cost. And so that is one of the bigger ones. I will tell you that most of the clients, they feel like they don't have control over that. That's one of the hardest ones to manage. So I think that's one of those things, if they can get some insight out of your podcast, figure out how to manage that better, that would be something to be very valuable to them.
To your, as far as these small employers, this is the thing, and I can see the frustration is that every day, like I had lunch with one of my buddies, Leto, and he has a foundry and they work on military equipment. Mm-hmm. He's like, I don't know anything about healthcare. I'm an expert in a foundry and metal works. If you're in sales, real estate, right. Whatever. You don't know healthcare. And it's one of the only pieces of businesses that the people running the show have no clue.
Right.
And you mentioned it earlier, benefit consultants. Mm-hmm. And so some of the real small organizations are not going to have that. But I think when you get to about 20 employees, maybe even 15, you can reach out to benefit consultants. And if people don't know what they are, so healthcare benefit consultant basically is a consulting firm or individual that helps businesses navigate healthcare.
Right.
They negotiate with insurance companies and PBMs because at the end of the day, if an employer said to their HR manager who has no experience in healthcare, hey, go manage it, they're going to get crushed. And so they get these professionals to help them. I'm actually going to bring someone on who's a benefit consultant in the very near future so they can explain to everybody, because I bet you 99% of the people listening to this don't even know what a benefit consultant is.
Right.
So it's really an interesting point that you say that people, these corporations, they're focused on their business and what they do, not on healthcare. And what a lot of people don't realize is healthcare expenses, the benefits, it has now become the second largest line item for businesses across our country, only after salaries and wages. It's that big. Yeah. And to your point, it's uncontrolled. Yeah. As far as decisions go, we talked about strategy and their business planning, but on a day-to-day basis, does it impact, are you hearing them say it impacts their hiring, their firing, how much they're going to pay their employees as far as a wage goes? Do you see that coming into play?
If you look at it, it's really the cost of employment. So if you're looking at what the labor cost is, doesn't even really matter what industry you're in. So if you're trying to determine what the salaries are, this is part of that cost. And so it's one of those things is taking into account, am I going to hire somebody at what level and what can I pay them? Right. This is something that comes into play. If the insurance was less, they could pay them more.
Yeah.
Yeah. And honestly, I've seen that in the past where there are opportunities like that where they have found savings and been able to do that because they want to be more competitive with their employees as well and pay them a better wage. I will say, when you talk about recruiting and trying to sell benefits to potential employees, and it's one of those things that's hard for the employees to look at healthcare. They want to know that you have it, what the benefits are. They're not really shopping it at the point they're looking for new jobs.
Yeah.
However, once you're in there, then once you've gone to the doctor and you've realized that's when you have a problem where you're getting denied, the cost. So your current employees are the ones pushing back more at the employers on making sure that you actually have good health care.
Yeah, to your point, you don't know how good that health care is till you get it.
You get it.
And, what if you have someone that you go in there and they say, okay, we're going to pay you $55,000 and we have benefits, or someone comes and says $65,000 and benefits. Right. Well, you don't know. Maybe the guy with the $55,000 offer is giving you better benefits that more than make up for that $10,000 difference in salary, and you don't know that.
Yeah, and it's one of those things. Not every company pays the same amount on the health insurance premiums. What I see with most of my clients, they'll pay for the employee's cost. But you start in with spouse and family. Very few pay the whole amount. Some will pay a fixed amount. Pay so much per month towards it. And so it's one of those things. If you don't look at that, you're not realizing what your package is.
And it's one of the things and why I wanted to have this podcast is because a lot of people do not realize that those are questions to ask. Yeah. Like if you go into an interview and they say, we have benefits. Well, is that just for me? Is it for me and my spouse? Is it for me and my spouse and my kids?
Yep.
So those, and they are not going to offer that up, and no offense to them, but that's not their job. That's your job to ask those questions. It's really interesting because you talk about the benefit package and also that sometimes whatever the cost of the healthcare benefit for that individual is, it dings into or reduces the salary. So studies have shown that in 2023, that the average cost for health benefits for a family of four is around $25,000. And for an individual, it's between $10,000 and $15,000. Now, the employee does pay some of that. The employer picks up on average around 70%. Okay. So think about that. I mean, if you're a company with 150 employees, that's $500,000, if not more. That's a big deal.
Yep.
And no one's happy with their health insurance these days that I am aware of, especially if you get sick and you need it.
Yeah.
So,
and the challenge really is for the smaller employers, because the bigger you get big enough, you have somebody in HR that you hire. They know what they're doing a little bit more in healthcare. They're working with the benefit consultants. They're getting you better actually deals than you as a 20-person office can negotiate yourself. So,
Yeah, and so there was a study, every year it's done, and I'm looking down because I can't remember all this, the Medical Expenditure Panel Survey on health insurance, and it's done through the Census Bureau. Mm-hmm. And what they said was that from a 3-year study from 20 to 22, about 86% of employers in our country, they covered their employees with health insurance. Mm-hmm. If you got to smaller firms, by smaller, they're talking less than 50 people, it's around 51%.
Yep.
It's like, I'm not advocating for everybody to go work for a big firm, but it is a call to action that it impacts employers, who they hire, who you're going to work for. It's not just if you get sick or not. This impacts every day what we do. And so I'm glad you're here and we're talking about it because I think it's super important.
Yeah. I mean, if you look at it, a lot of what I see is, if you're the employer's trying to manage their expenses, what happens is the renewals come and all of a sudden, depending on the year and what's happening with insurance, they get hit with a 20% increase. They can't take that all on themselves, and so they look ways to save it. So they're either cutting back something on what they're providing, or they're going to pay less of that and pass more of it on to their employees. So it's a tough thing for them to deal with.
It really is. And so you made me, I've got like a couple of notes here.
Okay.
So, JP Morgan, the big banker, I mean, they know what the hell they're doing.
Yeah.
They have a report that they put out every year, and they said that in 2018 to 2019, about a third of small businesses canceled their employee benefits because they just can't afford it.
Yeah.
And if you go to construction, if you go to the service industry like restaurants, it's closer to 40%.
Yeah, I was going to say based on the industry.
It's based on the industry. And look, at the end of the day, they're trying to find innovative ways to get around this. Mm-hmm. I mean, the marketplace exchange with the Affordable Care Act, that is one place that a lot of people look to. So it's really interesting. So, I used to work for Johnson & Johnson, huge company. Mm-hmm. And we have benefits, although I'll tell you, our costs, I know that we have really good benefits, but boy, they're expensive. Yeah. Now that I'm retired, I really feel that hit. But, when the ACA came out and they had the marketplace, there was talks. Now, if the leadership at J&J is listening to this and I'm wrong, I apologize. Mm-hmm. This is allegedly what I heard. I heard that keeps me out of jail-free card. But at the end of the day, I heard that they were talking about, should we just give our employees like $10,000?
Yeah, let them go to the marketplace themselves
and shop around and do it. I felt that might be the trend of where we would go, but I'll tell you what, I'm looking at the marketplace. It's being managed by the Medicare, by your managed care companies. Mm-hmm. Those prices are going up.
Yep.
Aetna just pulled out of it. Mm-hmm. I don't see a world without major changes happening where this train slows down.
Yeah, they needed competition within the marketplace. And what happened with all the companies pulling out, there's not enough competition in there to keep rates down. So, and we had the same thing, clients that looked at what if we just gave them the money and let them go get their own. The one thing they always came back with, well, we want to provide it for certain people. And through discrimination rules, they couldn't do that. And so then most of the time, when the clients I dealt with, it was they felt more comfortable saying, I want my employees to have insurance. I don't have faith that they will actually take the extra money we give them and go to the marketplace. So I'd rather just go ahead and bite the bullet and keep them on insurance. So I didn't have many that actually just dropped insurance completely.
But that's real.
That's real, though. It's real. And it gives you an insight of a lot of employers, how they think about their employees too. I mean, they're worried about them, and they want to make sure that they're cared for. So,
of course they're worried about them. Yeah. So it's hilarious. Yeah. So I'll give everybody a little insight here. I think I said this on a previous podcast. There's all 7 of them are starting to like run into each other. Yeah. But, everyone who has ever been on an expensive medication knows that a lot of drug manufacturers will give copay assistance. Yep. So if you have, let's say, a $50,000 drug and your copay is going to be like $10,000, the pharmaceutical company usually will help with a copay card.
Yeah.
Well, back in like the early 2000s, we used to like send them like little debit cards.
Yeah.
So they could go to the doctor's office and they could pay. And we'd go to the doctor's office and we'd say, how's everything going? They're like, nobody will pay their copay. We're like, what are you talking about? We give them the cards. Yeah, they just go to Walmart or to McDonald's and they eat and they eat. So we stopped giving them debit cards because they would use it for other stuff, to your point.
You go to CVS and buy whatever they wanted. It was at CVS.
It's crazy. Hey, it's Mother's Day coming up, so I'm going to go and buy Mom a gift. Yeah, it's and I don't blame them. Look, you know what? You have money in your pocket. You're going to do what you want to do. But, you know, everybody always says, well, what are some solutions out there? One of the things, and you just bring up a good point, is the insurance companies, so many of them have pulled out of the marketplace that there's not a lot of competition. Mm-hmm. So the prices are starting to go up quickly. But if I was king, I would basically be like, look, insurance companies, if you want to participate in Medicare Advantage, if you want to participate in the private employer market, if you want to participate in Medicare Part D, you have to participate in a marketplace exchange and manage Medicaid. You don't get to cherry pick where you want to go. You're going to participate in all of them because that's what's killing us is that, well, if they all leave, you know, to go to the most lucrative markets, okay, maybe that side will get a little bit more competition, but then we're hurt over here. I don't know. I'm sure there are unintended consequences to that, but that's one of my magic wands I would throw out there.
Well, if you look at that, it's insurance across the board. I mean, you look at it, different states and stuff like that where, you know, homeowners insurance, flood insurance, fire insurance in California, the insurance companies, if you can't keep the companies there and have competition, that's when the rates go through the roof.
That's when rates go through the roof.
Yeah.
No, look, someone else is going to have to take the torch on homeowners insurance,
we're not going to solve
property,
that
auto, all that stuff. We're in Florida and they're horrible.
Yeah.
So did we talk about decisions around full-time and part-time?
We didn't.
Okay.
So your question is on that, whether or not
does healthcare benefits, because obviously if you're part-time, you're not going to get benefits. Full-time you do. Does that impact whether or not they're going to have people push them into like 35 hours a week?
Yeah. I've seen that both sides.
Okay.
I've seen that on one where the employer is looking to do who I'm going to hire, and I'll hire a bunch of part-time people so I don't have to provide them insurance because I don't have to incur that additional cost.
Right.
I've also seen it on the other side where they have full-time employees who want to cut back, and they want to drop their hours down below the required in order to have health insurance, but either want to keep the insurance and they're not eligible anymore.
Right.
And it becomes a problem. And it's like, well, how do we get around this? And it becomes a challenge. Yeah.
It's interesting because you hear that. I mean, that's real. I mean, people like, to your point, I want to go part-time, but I can't lose my insurance.
Right.
I've talked to people that said, I want to retire.
Yeah.
But I can't till I get to Medicare age.
Yeah.
Because I can't afford not having insurance.
Yeah.
So, I mean, that's where we are in our country right now. Yeah. And we need to fix that. I just think it's crazy.
I mean, I've had conversations with clients of mine that are selling their business, and they're younger. And I'm like, one of the questions are like, well, what are you going to do about insurance? You're no longer an employee anywhere, so you need to find your own. And it's like things people don't think about. And it's not one of the costs they hadn't thought they would have to incur because they've never had to write a check for it.
Yeah.
I'm like, go ahead, price it. It's going to be more than what you thought.
It's crazy.
It's crazy. Yeah.
So you mentioned something I wanted to come back to about discrimination laws. Yeah. And so, and I think that's going to apply more so towards smaller businesses, where you've got a business, like say you have 15 people and, you know, there's 2 or 3 people in the family, family-run business, they're all over the place, and they want to have insurance. But they can't just have it for themselves.
No. And
so how's that work?
It's not one of those things where you can say, I'm going to have insurance for me and my wife and my key employees and not for anybody else. You actually got to offer the same packages. Mm-hmm. Not everybody has to pick the same packages. So you can have different levels, but you have to offer it. And I've had ones where clients have come in and said that, you know, one employee wants to be on their spouse's insurance, but it's going to cost them this much. Can you just reimburse me for that? And we haven't found a way around it because it's one of those things within the laws. Not sure how we can do it without violating some of the discrimination rules or causing income. We could do it with paying them, increasing their salary.
Yep.
and just letting them pay it. But they wanted, of course, to do it tax-free. So,
Well, and that impacts large employers. I mean, because like even when at J&J, if we had a spouse or a child who has a job that they can get insurance through, either we couldn't put them on our plan, but if we did, there was a charge.
Yeah.
And I get that.
Yeah.
I mean, why should one company have to foot the bill when there's another, someone else in your family is working for another company and now they don't have to foot the bill? If that was the case, then just offer crappy insurance.
Yeah.
And then nobody wants to be on your plan. They go to the spouse's plan.
Yeah.
So different strategies that employers that you're hearing them use. I think you and I threw around, high deductible health plans. Mm-hmm. That's really been interesting lately because I know, so I'll give you my take on it. And even though I do this podcast, I'm not, as much as I know, there's so much I don't know about insurance. But I used to say, you know what? I just want catastrophic.
Yep.
I don't get that sick. And if I do, I'll just pay out of pocket. So just give me something that if I get hit by a train or I get in a big accident or somehow I get cancer or something weird happens and I go to the hospital, that I don't lose my life savings. And someone goes, well, do you have a high deductible health plan? I'm like, yeah. They're like, that's what it is.
Yeah. I'm
like, well, then that sucks because my high deductible health plan is expensive as shit.
Yeah.
And I, spending over $10,000 a year. And I don't think the insurance company is going to pay anything because after my premiums, which is my monthly payment, a lot of people don't know that. And then my deductible after my high deductible premiums is $3,000.
Yeah.
Well, I don't think I'm going to spend all that money. So I'm just paying money and on my premiums and paying cash for everything else. So what are your thoughts on high deductible health plans and how are your employer clients working with that?
What I've seen is, I would say with high deductible plans, I would say I see it on the side of my clients and even in our firm, kind of evolved from when they first came out. It was the idea, to me, it came from, we're going to do these health savings accounts.
Right.
And so in order to be eligible for the health savings account, you had to do a high deductible plan.
Right.
The savings you'd have from the high deductible plan, they'd stick money into the employee's health savings account and the employee could put in money. So it was one of those things. If you're young and healthy, didn't have kids, because kids cost a lot on insurance, so they go to the doctors. It's like both ends of life. Right. When you're old and when you're young, you go to the doctor a lot. But in those young professionals, you think about, doctors, attorneys and accountants and stuff like that when they're young, those aren't the people with high medical expenses.
Right.
They could build this health savings account for when they need it.
Correct.
And that was the idea.
Yep. And it's pre-tax.
And it was pre-tax.
So think about your 401k.
Yeah. So
you would put money in pre-tax. So instead of paying after tax, you lose whatever 20% of that.
Yeah.
You get to put, instead of $80 on $100, you get to put the $100 in there.
Yeah.
And it can grow tax-free.
Yeah. It's like having a separate IRA that could be used for medical expenses. And if you use it for medical expenses, you don't pay taxes on it. It's great.
Okay.
However,
now
I see more and more companies going to high deductible plans without the contribution to the HSAs.
Oh.
So it's, in other words, they have the high deductible plans to save the medical expenses, but they don't make the contribution into the plan. They tell the employees they can make it in if they want to. But it's one way to keep their costs down. So because the high deductible plans, it costs less.
But
which
do you blame them?
Yeah. And by industry, sometimes that's fine. It depends on the industry because you look at what makes up your workforce.
Right.
If you've got a bunch of young professionals in there that there's not a whole lot of expenses, that probably works fine. I mean, you get different industries. I mean, I always, I've got a lot of construction.
Right.
The construction ones, my better ones, they need good insurance just in case somebody gets hurt, which it's different when you're an attorney and you get sick versus you're in construction and you get hurt. I mean,
and you're probably going to get hurt
and
eventually.
And I need you back at work, so I need you to have good insurance so that you go to a good doctor. Yeah.
So what used to be where like with Johnson & Johnson, they'd put in $1,000 every year, and then we put in whatever we want out of our paycheck.
Right.
and it would grow.
Yep.
Preferably. So what you're saying is basically now you can put money in, but the company's not.
Yeah.
But they can't. Think about it. As high as healthcare costs are rising.
And that's what happened. Yeah.
That's what happens.
Yeah.
They're like, okay, I'm already picking up enough for you. I can't continue going down this road.
Right.
So there was an interesting thing, and I'm looking at my notes, and I can't find where the note is, but basically I read about a study that said that 10% of people's take-home pay is now going towards healthcare. 10%.
And I would say most people don't even know that.
Correct.
Because they have no idea how much the employer is paying. I've only had one client that I've ever saw this. One client of mine, when he met with his employees,
Right.
his annual reviews, you give me your compensation, your bonuses and stuff like that. He put the healthcare costs in there. He put everything. He's like, basically, this is my cost of having you as my employee. And so just so you say, I'm paying for all these things for you. He was the only one that ever I saw do it.
So my old employer,
Yeah.
oh boy, they did that.
Yeah.
They let you know how
Yeah.
much your car costs and how much your health care
Yeah,
costs
yeah.
and all that kind of stuff. But I don't blame them.
No.
I mean, it is real.
Yep.
And so I want to take it back to big picture for everybody. The reason that we're talking about this is that healthcare costs impact all of us on a daily basis. We
Yep.
talk about inflation.
Yeah.
There's no way that this doesn't contribute heavily towards inflation. When you have five insurance companies, the five biggest insurance companies' revenue is over $1.2 trillion. That's with a T, $1 trillion every year. That's not even counting your drug wholesalers. That's not counting your drug manufacturers. That's not counting your hospital systems. Everybody is overcharging. Everybody outside of healthcare, whether you're sick or not, it's holding down your wages.
Yep.
Your employers now are not contributing to your high deductible health plan HSA.
Yep.
It's contributing to unemployment because they can't hire an extra person or two because it costs too much. Maybe you can't get a full-time job. You got to go part-time because
Get two
full-time
part-time jobs. Yeah.
they're going to have to bump you up another 20% approximately to pay for that. Yep. So, to give it perspective, the study I was reading basically said, and I don't think it was the JP Morgan study, but that 33% of our take home was spent on housing. Makes sense. 14% on food, 10% on healthcare.
Yep.
10%.
Yep.
And some of us don't even use it that
Yeah.
often.
Yeah.
And it's 10% of take home. It's just, it impacts all of us. And it's something that we need to pay attention to. I had a previous podcast and we were just talking about how it's just so confusing.
Yeah.
And you brought it up too, that, we're not healthcare, most people are not healthcare experts. No. They do not. I talked to my daughter and her friends. They're like, I'm like, do y'all know what a premium is?
Yeah.
They're like, no. Or deductible? No. You know what they do? They get a bill and they pay it.
Do they really know what coinsurance is?
Or coinsurance, or copay,
Yeah,
or
yeah.
high deductible.
Yeah.
And so on future podcasts, I am going to do that. I'm going to walk through. It's going to be health insurance
That's
101. But the problem
Yeah.
is, like, I got my mom's EOB, explanation of benefits.
Yeah.
Well, guess what? It looks like a bill.
Yeah.
And even though they put on there, it's not a bill. It's still so damn confusing that I'm like, oh my God, I get stressed out.
Yeah.
And I know what the hell I'm doing trying to read a 9-page document.
Yeah.
Seriously? They think an 84-year-old woman is going to read a 9-page document that you're going to fall asleep after like 3 paragraphs? That's not going to happen. I mean, the entire system needs to be revamped. It's hurting our country's competitiveness.
Yeah. I mean, it's one of those things that's more
getting pissed.
It's more confusing than it needs to be. I mean, my wife used to work at a hospital, and I remember.
I know. I want to have her on here, by the way.
I don't know if she'll do it, but one of those things, when one of us ended up in the hospital, you end up with bills, and you're thinking, okay, I went to the hospital, I'll get a bill. Well, no, it was an accident, so you get the ambulance bill, you get the hospital bill, you get the doctor's bill, you get the anesthesiologist bill, and all of them come to you, and you don't know, has insurance been taken out of this? Has it not? Some have, some haven't. Have you met your deductible yet? It is confusing as can be. I mean, she was in the industry and, it's one of those things. She can get through it, but it's just like, how does an everyday person that doesn't deal with this every day understand what I owe and what I don't owe?
It's insanity. So really interesting. As you know, my oldest daughter travels the world.
Yeah.
And as a dad, kind of freaks me out. But you know what? She's a big girl. And she's figured it out. She's independent. She's smarter than me. But she got really sick in Vietnam.
Yeah.
She got E. coli. She was in a very remote village, sick as a dog. I almost had to fly out there. But she made it to a hospital, a very good hospital. Here's what they did there. So she has traveler's insurance.
Yeah.
They basically walked her through when she was there, quickly walked her through. Here's all the things that are going to happen. Here's what they cost. Do you have a credit card? She gave her a credit card. She paid it. They took care of her. Done. Then she submitted it to her insurance company.
You get reimbursed for everything?
And they reimbursed her within 2 weeks.
Yeah.
Why can't we have, in the greatest country in the world, why can't we have that simplicity?
Yeah.
Seriously. I mean, I get that there are going to be some complexities to that, but at the end of the day, if Vietnam and travel insurance can pull that off, why can't we?
Yeah. I will say, because I've got a bunch of I have a bunch of physician clients as well.
Yes. Oh, they love insurance companies.
Most of them.
That's my big rock.
Yeah, most of them, it is the payer mix matters, whether it's Medicare or the insurance or where they're getting their money. I have some specialists that don't take insurance. Mm-hmm. And what they do is do exactly what you say. Is that here's what it costs for our procedure, and they will work with you. What insurance do you have? Let's figure out what your reimbursement is. But you pay for them. You pay them, credit card, cash. They'll help you finance it, whatever. And then you get the reimbursement back. At least at that point, you know what you're going to get back. They help you file the claim and everything. And it almost seems easier.
Right.
But only very few specialists that I have the clients do it.
Yeah, so there's different forms, like there's concierge medicine, which is kind of like cash pay, to your point. And then if you have insurance, I'm sure that they would do the same thing. There used to be, and I believe they're called indemnity plans, which is where you'd pay up front and then you submit for reimbursement.
Right.
I think those went away because they weren't as profitable.
Yeah.
And because people get to find out up front what they pay. I mean, it's so funny. Literally, like I have to, I go to the doctor once in a while. Like I go get some stuff burned off my face because I live in Florida. But at the end of the day, I sit there and I'm like, this is the only place that I go to that I buy something or have a service and I don't know what it's going to cost
me.
And I ask them, they're like, well, if you want to go to the front desk or to the office manager and we can call your insurance company and look at your benefit design and we'll figure it out. I'm like, I don't have 45 minutes to figure this shit out. My appointment will be over by then.
Yeah.
I mean, it's insanity. And I know for a fact, because I used to talk to buddies in the insurance industry, complexity and confusion is by design.
Yep.
And I do think that there is a wave and momentum where people are like, enough. Mm-hmm. We can't sustain this. Yeah. And so as part of what I wanted to have this talk with you today was to bring to people's attention, think of it in a different way. Yeah. It's not just if you need it. It's impacting our job, our workplace. Mm-hmm. It's impacting your pay. Mm-hmm. It's impacting the cost of goods. Yeah. It's impacted in a global marketplace, our competitiveness in the world. Yeah. Because they don't have healthcare costs like this. The government picks it up.
Yeah. Yeah. And as I say, in that magical world, that all of a sudden healthcare costs drop 10% across the board. If that truly happened, I would say probably 90% of my clients across the board would take that and pass it on to their majority of that to their employees.
Okay, everybody, did you hear that from the very smart CPA? Because I couldn't pass the CPA exam, so I went into sales. But he just said that if we got healthcare costs lower, his clients' majority would pass those savings on to you. There you go.
Because the labor cost is the labor cost. That's what they've already factored into their price. With nothing else changing, if they got that savings, it would basically be able to increase the pay to their.
So I love that. That's hilarious. Let me ask you a question. If you look 5-10 years down the road, and we know that healthcare costs are increasing like 5 to 7% a year,
That sounds low.
Okay, 7 to 10%. CPAs keeping me honest. What do you think is going to happen? What needs to change? What are strategies that your clients think that they can do, or are they just throwing their hands up?
It's one of those things they really don't know. It's almost one of those things, like I said, they used to provide and pay so much more of it. They get the renewal. The renewal is an increase of 15%. They can't handle the 15%, so they figure out a way to, how do I get this down where we pick up 10 and the employee picks up the other 5? And the other 5 usually comes from us reimbursing less of their costs, not doing an HSA contribution. It's somewhere else within the benefit package. We're going to offer not as good insurance. It just won't be as good. We'll have to, change what we're offering.
Yeah. Well, so what I would say to the employers out there,
Mm-hmm.
and if you're not an employer, say you're an employee, go to your HR department and say, look, if you don't belong to an employer coalition, go join an employer coalition. I worked with them. The bigger group that you're with, the more leverage you have.
Yep.
And they are very good coalitions out there. To your point, one of two things are going to happen. They'll raise the cost of goods. Mm-hmm. They'll hire less people. They'll pay us less.
Yep.
They'll pass on the healthcare costs more to us, or they'll stop covering healthcare.
Yep.
And if they stop covering healthcare, then there's fewer people with insurance. So guess what the companies who have insurance are going to do? The insurance companies are just going to raise premiums because there's less people and they answer to stockholders.
Yep.
Any other thoughts, 5-10 years, what people can do or solutions?
This is one area where I don't have the answer for. I honestly, and it's probably what I would say is most of the people in America, it's like they know there's a problem with their healthcare industry. I don't know what the answer is. People talk about different countries and how they do it. To me, I haven't seen one where it's the best answer. And it's one of those things, how do we make it better? Competition, to me, if you could increase competition, I think you could bring down some prices and maybe get to the point where some of the incentives are taken out of it for the pay would be a good thing.
Yeah. Well, I mean, I know. I mean, I'm more of like the atomic bomb.
Yeah.
Like I would make
blow it up and start
publicly traded companies. I wouldn't let them run our healthcare system.
Yeah.
Because they answer to shareholders, they don't answer to us. Yeah. People don't say, I don't want a one payer system. Guess what? 55 to 60% of our healthcare is paid by the federal government. Mm-hmm. So we almost have a one payer system anyway. It's just we are letting profit-driven organizations really drive the train. And then lastly, and it was on a previous podcast that I've done, we talked about the vertical integration, which basically means that these insurance companies have bought all the companies that they need all the way down to the physician practice. Yep. And they just buy and sell to each other. Yep. And we're at their mercy. So I will say there is, I'm gonna give a shout out to Healthcare Uncovered. It's a guy named Wendell Potter. He was a communication director for the big health insurer Cigna. He's great. He's been doing this a long time. Mm-hmm. But when I'm looking for suggestions on how we can make healthcare more affordable for employees, he had, there's like 4 or 5. So one is to make it easier to offer employer-sponsored plans to become eligible for lower premium and cost-sharing reductions in the marketplace. Mm-hmm. So you know what? I think employers are going to have to, if your HR department can't do it, get with a benefit consultant and look at all the different avenues out there. The benefit consultants, you need to make sure. Personally, sorry, big boys, I don't like you. I would go with a smaller benefit consultant firm. I'm starting to do consulting work for one, and we're going to try and disrupt things. There's something out there that people don't realize. There's a couple things that if you want to talk to a legislator or the media or your friends, so the marketplace premiums, those tax credits that are out there, those are not permanent. They need to be extended. If Congress doesn't act, they'll expire at the end of this year. And so those tax credits that help people with the marketplace, that's going to go through this year and then it's going to expire. So that's something that we want to talk to them about. The other thing, and this one really and truly shocked me, was inform your employees of their options to enroll in Medicaid. Now, I know Medicaid is a huge thing out there these days, and personally, I disagree with cutting Medicaid. Everybody's going to have their own ideas. Like, let's get rid of the fraud and the waste and the able-bodied people that are using it. Guess what? That's like less than 10%.
But that's not cutting Medicaid.
That's not cutting Medicaid.
That's eliminating fraud.
Exactly.
I mean, that's break that off and say that's eliminating fraud. Let's not cut Medicaid. Eliminate fraud.
Let's go after fraud.
Two different things.
And it's not just people. There are providers and companies that are committing fraud.
Oh, yeah.
So go after the fraud. Don't cut Medicaid.
Yeah.
Why go after the poor people again?
Yeah.
That was
Yeah.
ridiculous. But basically, I didn't know this. Workers who have income that's below 138% of the federal poverty level. So that is basically $21,500. So if 138% of the federal poverty level is $21,500. That's as an individual in 2025. If they have their income is below that, they're eligible for Medicaid in the 40 states that have expanded Medicaid. So that is something that people need to look into. And look, just because it says Medicaid and you think poor people, the same managed care companies that run Medicare, Part D, Medicare Advantage, and the commercial plans, they run Medicaid.
Yeah.
So you're going to get good care. But that is a really good option that I don't think a lot of people look at. And I saw you scrunch your eyes, so you're like, man, I don't know that. Maybe
No, I didn't know that one.
Yeah,
the other thing is,
I didn't know that one either.
I'd have to look at it and see like how many employees would be under that limit, though. Full-time employees.
Florida didn't expand Medicaid,
Yeah.
so your Florida clients do not qualify for that.
Okay.
It's only in expanded
Okay.
states.
Yeah. Okay.
There you go, the 40 states.
Okay.
And so the last one is, and Wendell, I'm going to give you another shout out. He helped to form a group called Loop. So it's the Lower Out-of-Pockets Now Coalition. And I'm a big believer in coalitions. So they already have over 100 organizations. They have patient advocacy groups, physician associations, health reform advocates, forward-thinking employers. They all get together, they go to insurers, they go to the legislators, and they're pushing for this stuff. There's a lot of good people out there that are fighting really hard for this. Once again, it's not just about if you need health care. It's impacting our pay.
Yep.
It's impacting inflation. It's impacting our economy, our competitiveness globally. I mean, it impacts everything.
Yep.
Scotty, I know we're drinking some good bourbon. I've drank more than you.
Yeah, I was going to say, talking too
You've been
much.
talking apparently more than I have. That's okay. Anything else that you would like to leave everybody with as far as, healthcare costs, the insurance industry, the hospitals, any insights? Because this podcast is for, and you are not the average Joe, but for the average Joe and Josie, whatever. Okay.
My biggest thing when they look at things to fix whatever it is, I don't think it's a one size fits all. And I also don't think it's one solution. So if you look at healthcare cost, I think it needs to be broken down into buckets.
Okay.
I'm not the expert on the buckets.
Keep going.
But it's got to be something like preventative care. Just your senior doctor, your pediatrician. That's, to me, is different than
acute care.
Yeah. Something happens to you and you're in surgery, there's outpatient surgery. That's different than being in the hospital for several days. I mean, I think there's different types of care and the costs are different. I don't think you can fix it all with the same solution. I think it should actually be broken into different components of how it's.
See, so this is the beauty of bringing in people who are outside the box and are not in the forest.
Yeah.
Because I think it's brilliant. So to your point, why can't we have carriers that handle just preventative medicine?
Right.
And carriers that handle just like trauma and catastrophic.
Yeah.
That would be more expensive.
Yeah.
Or you can, and then you have your contingency. Like, okay, I'm super healthy, I qualify for all this, and I just want to have this less costly.
Yeah.
So I can like do all my checkups and all my mammograms and colonoscopies, whatever. But in case something catastrophic happens, but not lump it all together. Now, I will say with the ACA, pre-existing conditions can come into play.
Yeah.
And so we have to be careful of discrimination. And just because someone's healthy doesn't mean that they should actually get a better deal than someone who's not. Yeah. And if they do, maybe the government needs to subsidize that. I don't know.
Yeah.
But we all have to keep a lookout for that. But I love that idea to customize it.
Yeah, and it's one of those things that if you can focus a little bit on the front end, get people healthier, going to a doctor, and actually being healthier themselves, the cost down the road should be less.
Yeah, but then you're going to get into like processed food, which is poisoning us.
Yes.
And you're going to get into the lack of primary care physicians,
Yes.
which nobody can get to a primary care physician because there's not good pay in there anymore.
I was going to say, everybody thinks a doctor is a doctor. The pay for doctors is completely different depending on what they do. Yeah.
There's a lot of things. We truly do need to have a system that is completely revamped.
Yeah.
Because it's unsustainable right now.
Yep.
It just really is.
Yep.
And with that, my brother, I appreciate you coming here today.
Nope.
We're having some good bourbon.
Yep.
And we're just bullshitting and talking about healthcare and I love the blue sky and the perspective of employers.
Yeah.
And anything else you want to tell the audience?
No, I think we're good. I appreciate it. Happy to be here for you. So
Okay.
keep building your podcast network.
We'll see what happens. Thanks everybody for showing up. Have a great day. And Scott and I are going to finish our bourbon.
Yep.
Peace out.
Peace out.